Hi guys, this is the second part of the renal pathology video, and today we are going to discuss about nephritic syndrome, which is a very important topic in exams. So what is nephritic syndrome? Nephritic syndrome is a renal condition caused by the inflammation in tiny filtering units of kidney. What are the tiny filtering units of kidney? That is glomeruli. And this inflammation damages the filters, and these will lead to blood in urine, protein in urine, and high blood pressure, edema or swelling, and also oliguria. So what is blood in urine? That is hematuria. So the urine becomes smoky or cola colored. And what is protein in urine? That is proteinuria. And this is a less prominent feature in nephritic syndrome, but a more prominent feature in nephrotic syndrome. And it causes high blood pressure, that is hypertension due to the fluid buildup, and also swelling or edema, especially around the eyes, that is periorbital edema, or within the legs. And decreased urine output is called as oliguria. So these are the features, that is inflammation or hypercellular glomeruli, and oliguria, cola colored urine due to hematuria, and hypertension. Then this nephritic syndrome is characterized by, you already know, that is hematuria. Hematuria contains, that is, dysmorphic red blood cells and also red cast in the urine, azotemia and oliguria, mild to moderate hypertension, and proteinuria and edema are common but mild conditions. So nephritic syndrome is characterized by headache, increase in BP, that is hypertension, periorbital or facial edema, which is a prominent feature, lethargic, the patient will be lethargic, low grade fever is also noted, and weight gain due to edema. And he is also characterized by proteinuria, hematuria, oliguria, and also dysuria, that is pain in urine. Then what are the causes of nephritic syndrome? We have primary causes, we also have secondary causes, and also have genetic causes. What are the primary causes? That is post-streptococcal glomerulonephritis. The patient will be having a primary streptococcal infection, that is pyoderma, impetigo, or pharyngitis, and followed by glomerulonephritis or nephritic syndrome. The second one is IgA nephropathy. The third one, membranoproliferative glomerulonephritis. Then rapidly progressive glomerulonephritis. Here there is formation of crescents and have a poor prognosis. What are the secondary causes? Systemic lupus erythematosus, lupus nephritis, Goodpasture syndrome, infective endocarditis, sepsis, diabetic nephropathy, and amyloidosis. And what are the genetic causes? That is Alport syndrome and Fabry's disease. So now we are going to study about the pathophysiology of nephritic syndrome. The first and foremost is glomerular inflammation. So due to the formation of immune complexes, antibody-antigen complexes, this will accumulate in the glomeruli and recruit the inflammatory cells, that is neutrophils, macrophages, etc., and causes the cell injury and inflammation. Okay, and the second one is basement membrane disruption. It allows the red blood cells and proteins to leak into the urine and causes proteinuria and hematuria. Okay, the third one is decreased GFR. So there is already we have an inflammation or swelling and cellular proliferation, immune deposition. So all these will leads to what? Blocking of the capillary loops, right? Yes, and there is decrease in GFR. So these are the pathophysiology of nephritic syndrome. The first one is glomerular inflammation. The second one is basement membrane disruption. So what all things leaks out? That is RBCs and proteins leaks into the urine, causing hematuria and proteinuria. And the third one is decrease in GFR due to the blockage of the capillary loop due to the immune deposits or proliferation or hypercellularity. It causes decrease in GFR. So we'll move on to the clinical conditions in detail. So hematuria, how hematuria is caused. So there is inflammation due to the cell injury, and which is in turn due to the accumulation of immune deposits. And this inflammation leads to damage in glomerular basement membrane, thus increases the permeability of glomerular basement membrane. So RBCs leaks into the urine and they get distorted as they passes through the damaged glomeruli and renal tubules. So what will happen? The formation of dysmorphic RBCs and also RBC cast in urine occurs. So inflammation lead to the damage of the glomerular basement membrane. The permeability of the glomerular basement membrane increases. So increased permeability. So RBC RBCs leaks out into the urine. As they passes through the damaged glomeruli and renal tubules, it gets dysmorphic and RBC cast are formed in the urine. Coming to proteinuria, the inflammation alters the glomerular basement membrane integrity. So what happens? This protein also leaks into the urine, right? Yes, a daily output of less than 3.5 gram proteins per day occurs. So there is mild to moderate proteinuria, but prominent proteinuria occurs in what? Nephrotic syndrome. In nephritic syndrome, there is mild to moderate proteinuria. Coming to edema, the glomerular inflammation occurs. We already know that, right? Yes. So this causes decrease in GFR, and as a result of decrease in GFR, it activates the renin, angiotensin, aldosterone system. So as a result of its activation, sodium and water retention occurs, and this will lead to edema. Okay, then coming to hypertension, what happens is that decrease in GFR, activation of renin, angiotensin, and aldosterone system. As a result of this, sodium retention occurs, yes, and vasoconstriction occurs, leading to volume overload, and this will eventually lead to hypertension. Then coming to oliguria, the normal output of urine is 1 to 1.5 liters per day, right? Yes. So what happens? Due to the decrease in GFR, the urine output decreases. Less than 400 ml per day occurs. Then coming to azotemia, as a result of decrease in GFR, there is accumulation of nitrogenous waste products such as urea, creatinine, and blood, leading to azotemia. So, as a summary, the urine findings, hematuria occurs. Gross or microscopic dysmorphic RBCs and RBC cast are seen in the urine, indicative of glomerular diseases. Cola-colored or smoky urine due to the oxidized hemoglobin present in the urine. And proteinuria, mild to moderate proteinuria occurs in nephritic syndrome. And edema, there is often mild or localized edema. Periorbital edema is very common in nephritic syndrome due to the sodium and water retention, due to the stimulation of renin, angiotensin, and aldosterone system. And what about hypertension? It is caused by fluid retention and activity of renin, angiotensin, and aldosterone system. Oliguria, reduced urine output due to decreased glomerular filtration rate. And what about azotemia? There is elevated blood, urea, and nitrogen. What is azotemia? Elevated blood, urea, and nitrogen, and also creatinine levels due to impaired kidney function. Azotemia is an important feature of nephritic syndrome. And the other systemic symptoms are fatigue, malaise, low-grade fever, may vary depending on the underlying cause. So that is all about nephritic syndrome.